The mystery of mediation. What am I talking about? Mediation. Well, I know there are some of you in the room who've read Achilles in Vietnam, and there's this incredibly powerful voice. A man who did 4 tours as 101st Airborne Sergeant had a scowl that would have turned Medusa to stone. It's like somebody said to Central Casting, send us a hard-bitten, scowling sergeant. This guy personified that. To mediate his story, if we put this man telling his stories that are a very important part of Achilles in Vietnam in front of a large audience, a live audience, him live, the audience live, he'd clear the room in a minute. People couldn't endure it. You get a great character actor like David Strathairn to study him and to do a great portrayal of this sergeant. The audience would be riveted, absolutely riveted. Or you put this sergeant on film and show it to a live audience. They're riveted. I don't pretend to understand this. It's something about the muse. It's something about the act of making art. The person who is the mediator for this doesn't have to have credentialed as an artist. Every one of you can be a very meaningful mediator and artist in retelling your patients' stories in the clinical record. Sometimes, and I just want to mention to you, I am very proud of a certain art form that I think I invented, and that's the art form of the disability letter. In the program that I was the psychiatrist for 20 years, the same program, and I had some of the same patients for all 20 years, inevitably there was a moment when there was a question of the veteran's application for either a disability upgrade or an appeal, or you name it. You've all been there. And I would find out as best I could, usually from the veteran, who the official examiner was going to be, because they had an appointment with this person, their name and their address. And I would write a letter to this person on the basis of, it usually was about 6 hours of asking them to tell me their story and to explain what they had been through, basically however they thought was important. And I would I would never lie for a veteran. I would never make anything up, but I would use the writing techniques of a fiction writer to try to bring this scene that the veteran was painting for me to life for the reader as much as the veteran was bringing it to life for me in telling it. And with the idea that the a disability examiner assigned by the VA to respond to this claim or this appeal, what have you, would say, oh, so that's what this man went through. And it's a good metaphor for the way we mediate the veteran's experience through responding with both our heads and our hearts. We, in the little program in the VA outpatient clinic in Boston, over 20 years, in theory, we were supposed to be getting psychiatric residents, but if I recall correctly, there was only one in all 20 years. But there was a steady flow, one every 9 months, I think, of psych interns, and occasionally some other mental health disciplines. And I would always tell them, no veteran will ever trust you if you conceal yourself behind a neutral, non-reactive, quote-unquote, professional facade. If you want to weep, weep. If you want to vomit, vomit. The veterans will regard that as a sign that you are listening and that you are hearing what they're saying. Now, this, of course, cuts very severely across a lot of professional culture, a lot of your training. It cuts across many cultural patterns, and that's a real strain, and a big strain on all of you. And it was a strain to some degree for me, but maybe I'm just a bit more sociopathic than you are, that it's a strain between you and your colleagues, that you will be accused, if you actually start to do this, you will be accused either to your face or behind your back of having gone native, of having begun to care more about the veterans than you care about your discipline, than you care about your institution. I once was very sharply corrected by the person who, I guess I was baiting her, who was put in to head the clinic where I worked for 20 years to replace the previous person who I had as my boss, who I really loved, a Vietnam veteran Navy psychiatrist. And I made a remark that I worked for the veterans, and she said, "You work for the VA." So there will be some serious strains. It is, as Judith Herman and Mary Harvey at the Victims of Violence program in Cambridge, towering figures in the field of trauma, not very much experience with veterans, really virtually none, but boy, they sure get it right. I swear that Trauma and Recovery by Judith Herman is the best single book ever written about trauma, including my own. I lost my train of thought that I was going to say about... It'll come back. Okay. I'm going to make some reference to what I prepared. The subject of moral injury is my favorite subject because it's such a rich site for understanding the human critter. When you look actually at combat trauma as a whole, it's an amazing crossroads for the whole human critter. There is the brain, and in an audience of military chaplains, and I've spoken to a lot of military chaplains over the decades, I somewhat poke at them and somewhat sort of want them to think about. I say it's an unfathomable mystery why God created us as physical beings. We are physical beings and we're stuck with it. And we do have this physical existence. And so we do have these big, expensive brains. But we are also a mind. And also we function within a society, a social system, and we inhabit a culture. That brain, mind, society, and culture are the four avatars of the human critter. And none of these has ontologic priority. Even though I am an MD and my PhD, folks, is in neuroscience, at the bench, wet neuroscience. And I tell you that the brain is not prior to mind, society, and culture. The brain co-evolved with mind, society, and culture, and is at the same ontologic level as the brain. All four of these avatars are at the same ontologic level. And they are each other's environments. They are each other's environments with obligatory exchanges across their boundaries with each other. So a reductionist account is, to my mind, deeply bankrupt. Deeply bankrupt. And I think in the website for this conference, I also included a lovely little rant that I did at the National Academies of Sciences, mocking reductionism and also mocking I admit it. I own up to it. I do get some pleasure from kicking sacred cows. And so reductionism is one of the sacred cows, and I confess that also good psychometric properties for a measure is another sacred cow. Have a look at it. It's a fun rant. It's called The Pen and the Dollar Bill, 2 philosophic stage props. And I hope that mystification will get you curious. Okay, so as I said, moral injury is my favorite subject. My definition of moral injury, which appears in the form I'm about to lay on you in Odysseus in America, is that when 3 things are present, and it's all 3, 1, 2, 3, a betrayal of what's right, that's in the culture, that's in the code of what's praiseworthy and blameworthy. In the local culture, I don't pretend to have discovered some truth about what's right and what's wrong that was somehow written between the stars for some ethical Einstein and Newton to discover, and certainly Shay hasn't discovered. I have no solution to the problem of the relativity of what is the code of right and wrong in different historical eras and different culture areas, local social construction of ethics. It's unfortunately simply a fact. But if there's a betrayal of what's right in the local culture, and I assure you that military formations, especially at war, create very intense cultures. Whoa, they are really intense, and they're palpable. So when there's a betrayal of what's right, number one, by someone who holds legitimate authority, that's in the social system, folks. Legitimacy and authority, sociology 1, political science 1. It's so betrayal of what's right by someone with legitimate authority in a high-stakes situation. Now, generically in war, the typical stakes, what's at stake? What's at stake is my life, or the life or maiming of a comrade that I have come to love, who we've fought side by side. We've shared the same fighting hole. We've covered each other's backs when we were taking a shit. That stake is inevitably in the mind. You cannot really conceive of moral injury unless there is an acknowledgement that the stakes must have been represented in the mind of the person who was morally injured. Now, that's my 1, 2, 3, and I'm saying all three. I'm not for a moment asserting that anything outside of that description doesn't matter, but I was trying to get it clean and clear and show proper respect for the repeated patterns that I had heard from veterans where it was leadership malpractice that had deeply been the engine of the destruction of this veteran's spirit and destruction of this veteran's capacity to trust others. So not everybody likes doing really, really unpleasant experiments, but I propose to you a thought experiment. It's ugly, but it will make the point if you choose to do it. And that is to vividly imagine for yourself a situation that fits your position in life, your aspirations, your connections in life, whatever that may be, and fits this description, a betrayal of what's right by someone who holds legitimate authority in a high-stakes situation. And if you follow that prescription for the experiment, you will find your guts churning, you will find your palms sweating, your heart beating, you will be physically in turmoil, I assure you. We're just one critter. We're brain, mind, society, and culture at every instant. And so there's that whole human critter again, and it's part of the fascination and satisfaction of doing this work. You will not only see aspects of the human critter that you would never have seen otherwise. But also it's remarkable, and I think Professor Sharon's description conveyed this, that we have the opportunity when working, especially with combat veterans, of meeting people who, their face sheet data doesn't look like much. They don't have, as Carl Jasper said, much realization in the world. Not fancy people, but very high rank in being. That's Jasper's phrase. Someone where you've gotten to know this person and you have a moment of reflection. Wow, it's really amazing knowing this person. And I know that I had that, not with everybody. That would be sentimental horseshit for me to say that. But with repeatedly, reliably, year after year, veterans coming through the program, getting to know them well, that a sense, wow, what a privilege knowing this human being. Okay, there is a burr under my saddle, and I need to own up to it. And that is that a couple colleagues at the Boston VA, one of them, unkindest cut, one of our former psych interns, Shira McEwen, and Brett Litz, who I've known for many years at the Boston VA, have started publishing work on moral injury, and they make no reference to a prior use of this term, and they use it in a slightly different way and do some interesting empirical research on it, and it's good. I'm glad they're doing that research. I really want them to say, well, this is how we explain moral injury, how we describe it, and here's how Shay explains it. And that would be fine with me. But I don't know what's exactly at stake in their apparently kidnapping the term. I don't much believe in intellectual property, frankly. But I have to own up that I feel abraded. But their definition is very interesting, and it's about something that's real and important, and you will encounter it, or you have already encountered it. And I'm going to reformat their definition following the same rubric. A betrayal of what's right. That's in a common denominator. In their version, by the self, something I did that was a violation of my own deepest ethical, human, moral commitments in a high-stakes situation. Now, I speak at a lot of military settings, and at the Marine Corps Combat and Operational Stress Control Conference in San Diego a year or so ago, the following story was told to me, which, as something that did happen at Fallujah, a Marine Scout sniper was supporting a Marine infantry unit that was heavily engaged and had taken several casualties from a very well-concealed and very skillful enemy sniper. And finally, this Marine sniper discovered the enemy sniper in his scope and saw that he was wearing what we would call a snuggly with a baby strapped to his front. Now, The Marine thought that the enemy sniper was using this baby as a human shield, but if you consider the cultural context, we have, as the observers, have to admit that we don't know what was in play. If the sniper was deep into martyr theory in Islam, he might have been thinking, I want my son to join me in paradise. If he was just simply being realistic about the fate of an orphan in his society, may have been thinking, rather screwed up thinking, I would say, but may have been thinking it's better that he's dead than that he have a life of misery as an orphan. And interestingly, the Iliad and the Odyssey give very vivid pictures of how bad off an orphan, even the son of a dead hero, that heartbreaking scene in the Iliad where Andromache has just said goodbye to Hector, holding their baby Astyanax, said goodbye to Hector as he's going out to the day's battle through one of the gates. And after he's gone, she talks to her baby and says, a bad day for you will be if Hector goes down. You will come to the table of your father's friends, and one of his friend's sons will cuff you away from the table and say, your father is not here. But one of your father's friends showing some kindness to you may give you to drink from his cup of wine, but only enough to wet your lips, not enough to wet your throat. I mean, it's an absolutely crushing heartbreak in this scene. And it's a picture, probably an accurate picture, that being the child of a dead hero was worth zip, zilch, nada. Being the son of a live hero was worth a lot. But let's not sentimentalize heroic society. So the point of this anecdote, this actual event, as I was told at Fallujah, was not what was going on in the mind of the enemy sniper. The Marine sniper understood the rules of engagement and the law of land warfare, which they are quite carefully, especially snipers, quite carefully trained in. And he understood that despite the fact that he could foresee the probability that the baby would be killed when he took the shot, that it was it was not only permissible, but as he understood his duty to his fellow Marines that he was supporting, who had taken casualties from this sniper. In any case, he understood that taking the shot was the right thing to do. And it's part of the tragedy of that particular MOS that you see the people you kill. Snipers and door gunners see the people they kill. There are many examples of foot infantry who've been through long, close fights with many enemy dead, many American dead, and yet cannot say, I killed that man. But snipers and door gunners invariably carry with them. And this Marine will carry for the rest of his life. He could see his round do its work, and undoubtedly the baby was killed. And this is a perfect example of moral injury. He was violating something deep in himself doing that. And the stakes were, of course, mortal for this baby. And It was his own violation. And this is, as those of you who've read Achilles and certainly also Odysseus in America are aware that I'm sort of an unlicensed philosopher, and I really did dig into what ethical philosophers had to say about doing such terrible things as this Marine sniper did. And they, in fact, have talked about this for decades under the heading, a strange locution, they call the heading is moral luck. Really moral bad luck. They never talk about moral good luck. But Bernard Williams and Martha Nussbaum, and war produces these in abundance, where there are no good choices, where whatever course of action you take, you're going to feel like shit afterwards. And that, in my view, can only be truly prevented, decisively prevented, by ending the human practice of war, which I deeply, fervently hope for and advocate. Now, my game as a missionary to the armed forces on preventive psychiatry has been to make changes in the institutions, in their policies, practices, and cultures that would reduce and mitigate the amount of wreckage, psychological and spiritual wreckage, that we cause when we send our young people to war. And so my definition that has as sort of its centerpiece leadership malpractice, a betrayal of what's right by someone with legitimate authority, is a reflection of my desire to make things better for the good young kids who go into harm's way for our sakes. And it turns out that the average ethical performance of our leaders at all levels is very sensitive to policy, practice, and culture. This is stuff we can do something about. And in fact, that within military circles, there's been decades of discussion of this. And often what may be really novel to you, hearing what I have to say, and I go into detail in Odysseus in America, what kinds of reforms do we need? I'm just mirroring back to the military folk what they themselves say. That's their best shot at how we can make our military institutions better. And I sort of hold their feet to the fire and say, yeah, do it. Do it. And why aren't you doing it? And let's get on with it. And it's been fun. It's been satisfying. It's been astonishing to me that I've gotten as much of a hearing as I've gotten within the armed forces. I never, in the 20 and a half years I worked for the VA, took on the VA, which is probably why they left me alone. I know that I would have been out the door on my can probably quicker than I could blink if I directly took on VA policy, practice, and culture the way I have taken on Department of Defense policy, practice, and culture. Go figure. But the fact is that the VA, I don't think, really cared. Now, there is one piece that does have a clinical take-home to it. which I realize that nobody in this room is likely to be on the American Psychiatric Association's DSM-5 committee, and directly or even directly in communication with anybody who is. But you may have been aware of a recent dust-up between Vice Chief of Staff, Army Vice Chief of Staff Corelli, and the president of the APA, because Corelli wrote to the president, whose name I can't recall at this moment, saying, I wish to inform you that the use of the word disorder in post-traumatic stress disorder is actively harmful to our service members. Would you please change the term to either just post-traumatic stress or post-traumatic stress injury? And he was reporting on his culture, that he was just simply doing that. And I had actually, the day before the International Society for Traumatic Stress Studies conference opened in Baltimore a few months ago, I spoke briefly with General Corelli in Washington on my way to Baltimore. And it was very clear in his mind why he was doing this, what was at stake. And I just want to remind you that it will be useful to you in speaking with veterans that in their culture, it is entirely honorable to be injured in the service of your country. To fall ill, to get a disease, malady, disorder, sickness in the service of your country, it's not dishonorable. No. It's not dishonorable, but it is something else. It's unlucky. It's unlucky. And in that world, that is stigmatizing. Nobody wants to share a fighting hole with an unlucky soldier or Marine, or a ship's watch with an unlucky sailor or an aircraft, etc. And that's why the heavens wouldn't open. It wouldn't stop people from being psychologically hurt, deformed, disabled by having gone to war. This isn't a miracle cure, but General Corelli, testifying for his culture, is saying this would make things a little bit better for some people. And so, since I do have this nasty trait of kicking sacred cows, I did publicly put this to the chairman of the APA committee to do the revision of at the conference, and he said it wouldn't make any difference. Wouldn't make any difference. And I sort of fumed and said, Matt, are you substituting your judgment of that culture for Vice Chief of Staff Corelli's? Do you really feel comfortable doing that? I don't think quick on my feet. I didn't say that. I should have. It's something I wished I had said, but I didn't. Anyhow, so, and here I'm holding this microphone, and a piece of bad stand-up is to ask you folks if your Überboss, the boss of all your bosses, Secretary of Veterans Affairs Shinseki, is suffering from missing foot disorder. I expect many of you know that he lost a foot to a mine in Vietnam when he was a company grade officer. And he recovered surgically and was fitted with a prosthesis. And recovered to the extent and the prosthesis was sufficiently effective that he could run with his troops when he was a battalion commander. And in that culture, if you're injured and you recover and are fit for duty, there is no limit to your advancement. Now, I'm going to pose to you it's kind of a trick question, but I hope somebody will surprise me with an answer that I don't have in my head already. What would an appropriate prosthesis be in the territory of psychological injury from war? Trauma, if you wish. Anybody have any ideas peregrinas, any wandering thoughts about that? Yes. Oh, for sure. I actually thank you. That's a wonderful way of formulating a supportive social environment as a suitable and functional prosthesis. And my view is that other veterans are an essential element. The peers are irreplaceable in the recovery context of a combat veteran. This shouldn't be a mind-reading exercise. And needless to say, posing this, I have my own ideas, and it's going to lead directly to the next thing I'm going to rant about. And that is that the prosthesis would be a device. It looks like a wristwatch, but it records a week's worth of sleep data at a time, a sleep monitor. It's known as an actigraph. It was developed by the Army at least 30 years ago, and the Army has done some amazing sleep studies, and it doesn't use the results. But it's... So anyway, I want to talk about sleep. That is a hobby horse that I ride at a gallop everywhere I go, particularly to military groups. The physiology here is really clear, and that is that sleep is fuel for the frontal lobes of the brain. The frontal lobes of the brain need it, and every hour of sleep that is lost and foregone drains the tank a bit. It's not a cliff that you fall off of, but it's a steady draining. And if you're really out of gas in your frontal lobes, it's a disaster. It is truly and deeply a disaster. Now, what makes it a disaster? Well, for one thing, your capacity for any kind of social judgment goes completely in the toilet. You lose emotional self-restraint. You lose ethical self-restraint. I'm fond of saying that when you're out of gas in your frontal lobes, you become a moral moron. I have loved working with the veterans that I have worked with, and I have grown to love them, many of them as individuals. But I can tell you they've done some very, very ugly things to other people, and to themselves, but to other people. And I feel quite certain that many of these ugly things that they feel deep shame over what they have done to other people were largely the product of their frontal lobes being offline, because I had set this so that I would be sure there would be time for discussion. There's, as I said, loss of ethical and emotional self-restraint, but perseveration. This is a neurologist's term for someone who just gets a bone in his jaw and won't let go of it. You know that tenacity. They keep coming back to a grievance that they have and just can't let go of it, just keep... And perseveration is a phenomenon of a disconnected frontal lobe. But there's also the fact that cognitive reframing, being able to organize the data in different configurations, is profoundly a frontal lobe function. Being able to say, this is the roads around Camp Lejeune. This is not the road between Baghdad and the airport. That abandoned car beside the road is just an abandoned car near Camp Lejeune. It's not an IED. And that the more sleep deprived you are, the less you're able to reorganize data in that way. Most of us do it just without even noticing it. It's an almost invisible function, but it's very critically sensitive to sleep. So my clinical take-home message, whatever health discipline you're working in, please, please, please inquire into sleep and develop a quick and dirty bag of tools that you have that is within your capacity to offer. I'm not saying that every single person who says that they have veteran who says that they have poor sleep or don't sleep anywhere near enough needs a sleep lab study. And my opium dream about this is that every single primary care physician in the VA, ideally every primary care physician in the country, every general medical officer in the military knows the basics of how to mitigate generic sleep problems in combat soldiers. Bill Nash, who a Navy psychiatrist, retired as a captain, was the Marine Corps combat and operational stress control officer in his final assignment in the Navy. And he deployed several times to theater. And he told me that the last time he deployed, he put a jug, he said, this big, in his sea bag of Prazosin. Anyone here able to tell me what Prazosin is? Yeah, you. It's an alpha-adrenergic agonist, 50 years old for high blood pressure. It relaxes the blood vessels in the periphery of the body, lowering the blood pressure. And an alert primary care physician in the VA in Seattle listened to his patients. They were World War II patients, in fact. What a novel concept. He listened to his patients. They said, Doc, you started me on that blood pressure med, and my nightmares went away. I'd been having dreams of Omaha Beach every single night, and they stopped. and I think it's that blood pressure medicine. And he paid attention. And then Murray Raskind, who's also at the Seattle VA in psychiatry, moved heaven and earth to assemble a double-blind, placebo-controlled trial, and has replicated, that trial has been replicated elsewhere. Very tiny doses. In my practice, it was 2 to 4 milligrams of prazosin. The recommended starting dose for high blood pressure, starting dose, is 8 milligrams. And in about 8 years of doing it, there was one veteran with very fragile physiology whose blood pressure dropped when he took 2 milligrams of prazosin. And when he then took 1 milligram, his blood pressure didn't drop, but he still got relief from his nightmares. So they just a totally unnecessary pharmaceutical chemistry note that prazosin was regarded as an inferior blood pressure med because it crosses the blood-brain barrier very readily. And so the pharmaceutical chemists were put to work to come up with other alpha-adrenergic agonists that were sufficiently polar that they wouldn't enter the brain very readily. And of course they did. And the generic name for the biggest name in this is terazosin. You notice the similarity. Well, guess what, folks? Terazosin doesn't do shit for nightmares. Why? Duh, it doesn't enter the brain. So you have this spectacle of a medicine that is long off patent, and nobody is making a nickel out of it. It's available as a cheap generic. There's no detail man or attractive young woman pushing this med to VA docs. And people are, I have heard from veterans that people are prescribing terazosin to them for nightmares. Ugh. It just, never mind. I said I was going to rant, and I'm going to restrain it. So, I've defined the 2 flavors of moral injury, and it's interesting that the group that defined it as something that one does oneself highlighted that moral injury of their sort destroys the capacity for trust. And of course, I have emphasized that that is really the life-wrecking character of moral injury as I've defined it. So you can pick your flavor. It devastates trust. Both of them. Now, what are the generic... First of all, what does it mean to have your capacity for trust destroyed? What's that look like? Anybody? What's it look like? Cannot trust. No intimacy. That's a real serious loss. But has anybody ever gone to jail for no intimacy? No. The fulminating part, the most really life-wrecking, instantly life-wrecking part of a destruction of trust is that you expect every single human being that you encounter to be interested in harming or exploiting or humiliating you. When trust is gone, it doesn't leave a vacuum, nothing. It's replaced by this active expectancy of harm, exploitation, or humiliation. Now, a lot of people would say, oh, well, that's paranoid. Okay, but that's psychobabble. Let's stick close to the phenomenology. We don't learn one single thing more about this human being to say he's paranoid than to say he expects other people to exploit him or harm him. And so If that is your expectancy, there really are not a lot of strategies open to you. And these strategies are quite familiar, I expect, to all of you, because you've witnessed them or heard about them as part of the veteran's history. Number one, you can strike first. And boy, we've all met psychologically and morally injured veterans who they're going to get their blow in way before you can. They're going to make sure they're going to do it. Strike first. The second is to run and hide, and to avoid. It's the whole avoidant constellation in PTSD is certainly reproduced in moral injury, where people will go to great lengths to avoid coming into contact with others for fear of this whole pattern of harm, exploitation, and humiliation. Just don't have anything to do with people. Simpler. And then the third, which of course Odysseus deeply identifies, is to create an elaborate false front. Odysseus is a gifted liar, a brilliant liar, a fluent liar. And he creates a number of false identities in the course of the Odyssey. And there's that wonderful scene on the beach in Ithaca. The Phaeacians have picked him up and put him down on the beach. He's sound asleep, and he wakes up and he is disoriented, doesn't know where he is. And Athena appears in the guise of a handsome young noble herdsman. And Odysseus starts telling this handsome young man this pack of lies. And after this goes on for a while, Athena just cracks up and says, "Come on, who do you think you're kidding here? Do you know who I am? I'm your tutelary deity. I know exactly who you are. I know more about you than you know about yourself." And it is one of the fundamental strategies.